to our three-part presentation, Riding the Waves of COVID-19, an information series for families of children and youth with special healthcare needs or disabilities, presented by Family Voices of Wisconsin and UW Pediatric Pulmonary Center. A few instructions for this webinar. We will be recording this webinar for future viewing. Your microphones have been muted and cameras disabled. Please keep your microphones muted and cameras turned off during the presentation. We will be taking questions that we will try to answer at the end of each presentation. You may enter your questions in the chat box throughout the presentation. We are not able to answer any questions about the medical conditions of your children. If you have questions specific to your children's medical conditions, please contact their healthcare provider. We may not have time to address all questions entered into the chat box during today's presentation. We will be reviewing all questions submitted through the chat box and will send out a summary of the questions and answers. We will be posting the responses on the Family Voices website and the UW Pediatric Pulmonary Center website. A survey link has been shared in the chat box and will be continued to be shared periodically throughout the presentation. Please fill out the survey to provide input on future topics and to submit any additional questions. Today's topic is a look forward and how to emerge from staying home, presented by Dr. Mary Ehlenbach. Thank you for joining us today, Dr. Ehlenbach.
Thank you, Stephanie, for that kind introduction. And really, it is my pleasure to be participating in this webinar today. I certainly hope that you all will find the information I'm going to share to be helpful. A little background about me. I am a associate professor of pediatrics at the University of Wisconsin School of Medicine and Public Health, and I'm the medical director of the Pediatric Complex Care Program at UW Health American Family Children's Hospital. So I'm here to talk today about moving forward, but before we do that, I want to take a moment to recap some of the excellent points that Dr. Balasubramaniam made in his presentation yesterday. We all know that all the hard work that you and society at large have done to stay at home has indeed helped to flatten the curve, and that our healthcare system, fortunately, has not been overwhelmed. But we also know that COVID-19 hasn't gone away, but we have had a chance to take some time to learn about the virus, the illness it causes, and the steps that we need to take to keep people healthy moving forward. And while it's wonderful that we in Wisconsin have avoided widespread of coronavirus, I think it's very important to acknowledge that there have been costs associated with shutting down society. These costs come in many forms, and some may be particularly relevant to families with children with special healthcare needs. Some of these costs are economic, including loss of work. We've had many families that have been noting financial hardship or concerns about their finances. Some costs are physical. For many families, parents have been performing most or all of their child's cares, as there have been less opportunity for time outside of the home, such as school, less opportunities for respite care, home nursing, and personal care worker services. And as such, many parents have not had opportunities for much self-care, which can be wearing as time goes on. We also know that there have been developmental, social, emotional, and educational costs associated with physical and social distancing. Opportunities for physical therapy, occupational therapy, speech therapy have likely decreased. And while schools have been providing online services, we know that those services work better for some children more than others. And many families have started noticing some regression in their children. Additionally, children with special health care needs generally have a very large team of folks involved in their lives. And there's been substantial disruption to the size and function of this team in our current environment, which undoubtedly creates challenges. Many families have noted behavioral and mental health concerns in their children and themselves. And finally, medical costs. People have been putting off routine and non-urgent care, which is probably okay in the short term and the right decision several months ago. But as time goes on, there may be consequences. So as society begins to reopen, it is really important to keep in mind the goal of balancing the risks associated with contracting COVID-19 with the benefits of reentering society so that health and well-being is optimized and that the undesired costs and consequences are minimized. So, will COVID-19 spread when society reopens? We heard this yesterday from Dr. Balasubramaniam, and I think it's important to emphasize this again today. We do anticipate that the virus will spread as society reopens. Our public health infrastructure will be focusing on identifying and quarantining those who are ill, as well as tracing those who've been in contact or exposed to ill people so that they can be monitored for illness as well. And this approach is essential for containing the spread of COVID-19 to manageable levels. So, what is it safe to do? My team at the Complex Care Program has had this question from many of our families. Um, People are in general wondering about what it is safe to do as society is starting to reopen. Some of the questions that we've heard are: should we allow private duty nurses, personal care workers, and respite providers back in the home? Should a parent return to work? Should they bring their child in for non urgent but necessary medical appointments and procedures? Can their child resume therapeutic and educational activities? And what about school in the fall? These questions are all really excellent, but they're also really hard to answer. And the bottom line is that there will be some situations that will clearly fall into a category of definitely not safe, do not do, and other situations that would fall into a category of yes, these are very safe and you should do them. However, most scenarios are going to fall somewhere in the middle, and they're going to be gray instead of black or white. So each family is going to need to balance the benefits and the risks to determine if it makes sense for them to pursue a specific scenario or activity. Individual circumstances of the child, the family, the activity, and if any modifications can be made to increase safety are all going to need to be taken into consideration. So, my advice to you is don't be afraid to ask questions to help you make an informed decision. And in the end, trust yourselves as parents and experts on your child with special healthcare needs to make the right decision for your child. I'd like to take a moment to talk about some of the modifications that can be made to decrease risk of COVID-19 spread. So, first of all, limiting the number of people to whom your child is exposed is a really good starting point. Fewer people and more space is better, so people are able to spread out, and being outside is a great option. Of course, Wisconsin weather permitting. Second of all, you've heard this a million times before, and you'll keep hearing it until the end of days. Hand hygiene is a very important way to prevent spread. You should wash your hands with 20 seconds, for 20 seconds with soap and water. And if soap and water aren't available, an alcohol-based hand sanitizer is second best. And finally, avoid touching your face, mouth, nose, eyes, mucous membranes. And then finally, I'd like to touch on using masks, or also known as cloth face coverings, as they are another way in which we can decrease the risk of spread of COVID-19. So I'm talking here about non-hospital grade masks. Protective equipment, or PPE, is still in very short supply, as I'm sure you all have heard. And in general, this should be preferentially used by healthcare workers who are caring for people with COVID-19. But cloth face coverings, also known as personal face coverings or homemade masks, can help to decrease the risk of spread when it's not possible to distance from others. And it's important to know that a mask protects others more than oneself. If you cough or sneeze, it's contained in your mask and therefore not spreading to other people. And it is also important to note that some people are not eligible to be using masks or cloth face coverings. The folks that fall into this category are young children. Generally, we're saying less than age 2. People who have trouble breathing, people who are unconscious or incapacitated or unable to remove the mask independently. Finally, I'd like to emphasize that it is important to continue to get regular health care. Putting off needed but not acutely urgent health care may have dire health consequences. And healthcare facilities are working very hard to keep the hospital and clinics safe for patients and families. Also, most places have rapidly embraced telemedicine technology. So telephone and video visits may be an option now for you or your child. And finally, don't lose touch with your child's healthcare team. We're here to answer questions, to help support you, and to be a part of your lives, physical and social distancing or not. And I also wanted to emphasize that while it may be frustrating to have changing recommendations, it's important to acknowledge that we are all still learning about COVID-19 and its spread. Recommendations may change over the coming weeks and months as we see what happens as society reopens. And as always, it's important to be prepared. Make sure that you have your child's medications, equipment, and supplies on hand, and make a caregiving backup plan for your child in the event that you become ill. And finally, stay tuned. Um, as things evolve with this global pandemic, um, it's important to be in touch with public health officials and experts in healthcare to do all that we can to keep everyone safe. And with that, I want to say a big thank you to the UWPPC and Family Voices of Wisconsin for providing me this opportunity to share some of what I know with you. And with that, I'm happy to take questions.
Thank you, Dr. Ehlenbach, and thank you to all those who have submitted questions throughout the webinar. Our first question today is, I think, one that many of us have, which is, what should I do about school in the fall for my child?
Oh, Stephanie, that's an excellent question. And I wish I had an easy answer for that one. I think that there's still a lot that's up in the air. I think that we will know more over the coming months as time goes on with folks starting to re-enter society. So I think at this point, it's probably too early to call. I think that in general, we know that children have much milder disease than adults tend to. So part of me wants to very much hope that school will be up and running in the fall and we can resume a sense of normalcy, particularly because of those costs that I mentioned, the educational and social emotional costs. I think in general, human beings aren't built to function in the environment that we've been functioning for the last several months. So I think that it's important to stay tuned. And again, as we think about school in the fall, make sure that you're balancing the risks of being in an environment where there's lots of other people and potentially spread of the illness with the benefits of school, and look for opportunities to make modifications. Be in touch with your child's teachers and care team at school to see what their processes, what they're planning for the fall, to see if there's an opportunity to increase safety.
Thank you. Another question that just came through is it safe to get together with friends, attend lessons or camp?
Oh, that also is a very good question and a little bit tricky to answer. I think going back to that, the idea that fewer people is better and being more spread out is better than being packed in together. So I would not recommend going to a rock concert right now where you're packed into the mosh pit. I don't know how many of you have that high on your to-do list, but that probably falls into the category of not wise to pursue at this point in time. However, an outdoor picnic with friends where people try to stay spread apart and bring hand sanitizer likely is pretty safe, and as long as no one's ill. And probably there are benefits there from a social and emotional standpoint that may outweigh the risk depending on your child's specific situation.
Thank you so much, Dr. Ehlenbach, for sharing a look forward and how to emerge from staying home. We appreciate your feedback to all that have attended today. So we have shared a link in the chat box and would appreciate you completing the brief survey and providing us with some feedback. Thank you again, Dr. Ehlenbach, and thank you to all those who have attended.
Thank you.